Maintrac is an approach to monitor patients with malignant tumors during the course of disease and to check whether the cells which are shed by the tumors into the circulation have growth activity, and this would be a sign of a more aggressiveness of the tumor. Every tumor can release cells into the surrounding tissue or into the lymphatics, and from there into or directly into the blood, and these are called circulating tumor cells. These cells can be the origin of metastases in the future, and therefore it's important to detect and monitor them during the course of disease. The Maintrac method uses the fact that tumor cells carry structures on their surface which are not expressed by normal blood cells. So we use antibodies against these structures, and these antibodies are fluorochrome labeled, and when they bind to the structures on the tumor cell surface, these cells become fluorescent and we can detect and monitor them. It's special with Maintrac that we do not, as some other groups do, enrich the cells. We do not fix the cells. We do not separate them from the white blood cells. We just observe them among the normal white blood cells with a special microscope which detects these cells for us, so we can check whether they are living tumor cells. The most important thing about these tumor cells is whether they can be eliminated by different substances. And that's also how the conventional chemotherapy works. We can add different substances to the tumor cells in the test tube and check whether these substances are capable of killing the tumor cells. And these substances then are the most probable agents to kill the cells also in the patient's body. And we have seen that some of the biological substances are almost as effective as conventional chemotherapeutic agents. Well, it is quite well known for all therapies that patients respond differently to the different therapies. That's why it's so important to test whether the substances planned to give to the patients really will work. And we can, on one hand, test whether they are effective in the test tube, but we can also subsequently monitor whether the cells in the patient's body are in fact reduced and whether this therapy is active also in the patient's body. Well, it is quite well known that tumors become more aggressive during the course of the disease. And this is assumed to be due to cells which are called tumor initiating or tumor stem cells, which have a high growth capacity. These tumor stem cells sometimes can downregulate their surface structures, and that makes it more difficult for us to detect them. We can, however, grow these cells in a special growth medium for cancer cells, and these cells, which are capable of growing, form small spheres, and we can detect and count these spheres, and the number of these spheres is a sign of aggressiveness of the tumor. So we can, during the course of disease, monitor whether the tumor becomes more aggressive. Bloods can be sent to our lab, and they can be up to 3 days old, and we still can very well analyze the cells in the blood. And AONM has shipping kits which keep the temperature at ambient temperature, and this is the optimal way to send the samples to us, and we can then analyze the cells in a reliable way.